I am 3 days postpartum with my fourth baby, and I wanted to show some of the movements that I've been doing to help support my initial healing postpartum. And that's super gentle breathing, some mobility, nothing too intense because I'm really just focused on resting in bed the first 5 days postpartum. After that, I'll start moving around my house a little bit more. And then around like 10 days postpartum, I'll start to go outside to go do some short walks, start integrating a little bit more like gentle core exercises. But the movements that I'm going to be doing in this video are going to be in our free Early Postpartum Recovery Course. So I'll link that down below. The free course is about 4 weeks long. It has different breathing drills, mobility, gentle core exercises, and just a general guide to help support you with initial movement in the early postpartum. 4 to 6 weeks is a long time to do absolutely nothing. It's a really great time for us to begin to reconnect with our core and with our pelvic floor, but it's also too short to rush back to the gym and start more structured exercise. And so in this first month to 6 weeks postpartum, it's really beneficial to just focus on reconnecting, gentle movement to keep us comfortable, but again, nothing too intense at all. Hey, my name is Gina. I'm a perinatal fitness trainer and birth doula, and currently postpartum with baby number 4. She was born just a few days ago. And so I'm just starting to do some really gentle movement to help support reconnecting with my core and with my pelvic floor. I did have a vaginal birth, no tearing, and so my recovery may look a little bit different than yours. It may look very similar to yours. So try not to compare like where I am at currently to where you may be at is going to be really important because each of our journeys is going to be really different. And even my own journeys between my postpartums has been different each time as well. And so the first thing that I'm going to be doing to help kind of reconnect to my core and to my pelvic floor is just to do some breathing. And so I'm going to find a more reclined position. You can either lay back on your pillows or you can lay flat on your bed. And I'm just going to be focusing on feeling my back push into the bed and my rib cage expand out to the side. And so you can sit in whatever position is comfortable for you. You can have the legs up if legs extended is kind of uncomfortable, or legs can be straight. You could also have your baby just right on your chest. And so I'm just going to be thinking about my ribs expanding outwards and my back pushing into the bed as I inhale. And then exhale, I'm just going to gently let go. So I'll do about 10 breaths here, just feeling my back expand. There will be some expansion in the belly, but it's not like as much as possible. I'm really focusing on more breathing into my back area. After about 5 breaths, I'm then going to just engage in my core a little bit. This is at like 30%, so it's not super intense. So big inhale, exhale, lift up in the pelvic floor. After that, I'm going to come into a more rounded position, and you can grab like one of your pillows. If you've had a C-section, this is probably not going to be applicable to you. You might just want to be in a more upright position and just round in your back if that feels good for you. If you did not have a C-section and this feels comfortable, you'll just take the pillow and you'll round over it. Okay, we're going to focus on finding some rounding in the back to breathe into this back body. So during pregnancy, we tend to favor a very extended spine position. And so this back space here can get really restricted and tight, which can impact how we can breathe, which can impact like our pelvic floor and core function. So we're going to find that more rounded position and take 10 breaths breathing into this space. And so my mic is on my chest, and so when I round, the audio might get kind of weird. So you're going to round in this position and then take a big inhale. So I'm really focusing on feeling my back expand. And so if you've been having any like back pain, especially like at that rib cage area, this can be super helpful to releasing some of that tension. Next, I'm going to do some thoracic mobility because just sitting in bed, nursing a baby all day, my back just gets kind of sore because it's like stiff and stuck. And so adding in some thoracic movement can be super beneficial. And so I'll just start in this more like kneeling position and then just arch in my back and then round in my back, just kind of moving between the two. So nothing too intense. If having your butt towards the bed is kind of uncomfortable, you can also come into more like tabletop position as well. But you can also bring the hips down if that feels better for you. So just kind of choosing whatever feels best. After I do the front to back movements, I'm then gonna find some side body movements as well. So just kind of reaching overhead for that lateral side body opening. Sometimes we forget that the rib cage also has the ability to laterally bend. And so finding that movement can be super beneficial. And then the last thing that I'm going to be finding is going to be that rotational movement. So you can either come to a seated position or whatever feels most comfortable for you. And I'm just going to reach one arm back to rotate in one direction and then come in the other way. So we're just kind of alternating between each side. If you're finding that it feels kind of sticky as you rotate or you feel kind of stuck, just find a little bit of rounding in the back as you twist. So usually just the combination of those three directions of movement really helps to kind of release the stiffness in my back, which helps me be so much more comfortable. The next area that I'm going to be targeting is going to be my hips, because again, I'm just sitting in bed all day. It's getting kind of boring. And so my hips are also starting to get kind of stiff, but I don't necessarily feel ready to do like a ton of the hip mobility movements that I was doing at the end of my pregnancy. So the first one I'll do is just this like figure four. So I'll come onto my back and I'm just gonna bring the ankle onto the knee, and then I can lift it up here so I feel a little bit of a glute stretch. And then if I want, I could bring that foot down and just kind of like twist in like the lower back to find more of that opening. And again, baby can also come and hang out with you as you do this movement. So just a gentle twist here. And then we can do the other side. So ankle is there, and then coming across. And that's kind of it for the gentle mobility and breathing that I'm doing in this early postpartum time frame to help me reconnect with my core, with my pelvic floor, to introduce some movement that feels comfortable for me so that I don't feel super stiff. I'll do those moves or variations of those for about 5 days. And then I'll start doing a little bit more upright mobility movements around 5 to 10 days. And then around the 10-day mark is when I'll start going for like those walks and integrating some of those core exercises. So if you want more of that guide to help you with that gentle movement in early postpartum, definitely check out our free Early Postpartum Recovery Course. It's a 4-week program, very loose to follow. It's not super intense. It's just got breathing, mobility, gentle core exercises, and just a general guide to help you figure out how to even begin the process of movement again in the postpartum phase. If you're moving beyond the early postpartum and you're wanting more structured exercise to help you return to fitness, check out our online postpartum fitness programs. Our online postpartum fitness programs are offered in 2 main formats. We have our app-based program, and then we have our on-demand program, which is going to be those follow-along videos. The app-based program is what we use with our in-person gym clients. So we have tested, we're constantly updating that program. It's in the Team Builder app as a list of exercises with short demo videos. And there's 2 versions to it. We have our full-length workouts, which are going to be 45 to 60 minutes long, but we also have the mini ones because not all of us have a lot of time with these little babies. The mini workouts are 15 to 20 minutes long. But if you prefer to follow a video as you work out, we do have our postpartum on-demand program, which I'm going to be refilming here in the next month or so to update the programming, to update the videos and all that stuff as well. So you can check out all of our postpartum fitness programs on our website at mamasayfit.com and use code YouTube10 to get 10% off any of our online offerings. I'll be sharing more about my early postpartum recovery journey and my postpartum return to fitness journey. So if you want to check that out, be sure to subscribe to our channel so you get notified whenever I release new videos, and you might get a little bit more peeks of this cute little girl. So thanks for watching. I hope you all are feeling really good in your postpartum too.